My name is Greig Glover, and I'm on the hospital medicine service at St. John's Hospital. I'm board certified in family practice, and I've been practicing for a little over 20 years. I think probably the biggest thing is the culture. All of the programs that I looked at were approximately the same from a financial standpoint. The benefits are all about the same. They have to be competitive. But I'd say the thing that really stood out the most was the culture. Again, having practiced at a lot of other places in the Minnesota area, there's something different here that I liked. It's still, we're part of a health system, but it's still more of a community type hospital. You're not a number. And I'll tell you, after working here for, 15 months or so, there's something different here. Everybody at St. John's, where I work, knows each other. I know almost all the nurses by first name basis. It's a very much the typical community hospital that you would see probably in a community of maybe say 50,000, but it's here in the Twin Cities. We have a residency program here, which is another, I think, a real strong aspect. We have, I believe, 18 residents, and they're on at all times. We work with them. They go to codes. We watch them when they, for example, when they go to codes, they take care of our patients after hours. We have a chance to teach them, though not formally, but informally, almost every day. Probably one of the strongest residency programs I've ever had worked with from a family practice standpoint. But I think the idea that it's a smaller institution, yet we take care of fairly sick patients with an ICU, a dialysis unit, cardiology unit that is doing more and more. I think it provides that unique opportunity to do a lot of really relatively sick patients in a smaller hospital. We have a full spectrum of specialists here, from neurosurgery, neurology, nephrology, cardiology, which are the HealthEast heart care group, and getting us a consult is very easy. One thing I found is really interesting here is they're all community-based specialists, and they want to see your patient, and will frequently come in even after hours to see your patient if you ask them to. Never have I ever felt that the specialist was condescending or difficult. But always seem to work collaboratively. The other thing I would say, one thing that might be, I think, is an important aspect is the physician engagement. We have our medical director is Doug Berg, who I think goes out of his way to really work with the group and to talk with us as far as some of the decisions that are going on. We meet the third Thursday of the month and have our large group meeting where everybody gets together and we talk about issues. In addition, HealthEast has a survey that they go through every year that's part of the employee engagement process, and then those survey results are followed up. And again, that's not something that you typically see in every organization, and so I think that the feeling that at least you don't always get your way, and decisions maybe not always exactly what you want, but your voice is heard and you have an opportunity to participate.